All right, welcome to The Explainer. Today we're diving into a really fascinating and frankly pretty controversial topic, the idea of using metabolic therapies to treat cancer.
So what if we could just starve cancer? It's a really simple but powerful idea, right? Instead of only trying to poison cancer cells, what if we could just cut off their food supply? Let's dig into what that actually means.
Okay, so this brings us to this big concept that's getting a ton of buzz, metabolic oncology. Some are calling it a brand new frontier in cancer treatment, but what is it really?
Well, the core idea is pretty straightforward. Proponents say that cancer cells just have a different appetite than our normal healthy cells. They're incredibly hungry, especially for things like glucose, and they burn through fuel in a really unique way. So the hope is, if you can target that specific fuel supply, you might be able to stop the cancer right in its tracks, basically starving it while leaving your healthy cells alone. So, what's the big promise here? Why is this getting so much attention? Let's look at the potential benefits that have its supporters so excited. Well, if you listen to proponents, organizations like Heal Navigator and Meekin Metabolic Care, they list some pretty compelling advantages. They suggest this approach could slow down tumor growth, make traditional treatments like chemo and radiation work even better, and maybe even help overcome drug resistance. The ultimate dream? A more targeted treatment with way fewer awful side effects. Now, here's what's really interesting about all this. We're not necessarily talking about creating brand new, super expensive drugs. Instead, a huge part of this strategy involves repurposing common medications. Using familiar drugs in a completely new way.
Take metformin, for instance. It's a super common diabetes drug, but researchers started noticing that diabetic patients taking it seemed to have a lower risk for developing certain cancers. That observation sparked a ton of interest in how it might be affecting cancer cell metabolism directly.
Then you've got statins. The drugs that something like 40 million Americans take to lower their cholesterol. Well, a growing body of research suggests these might also have a protective effect against some cancers, possibly by messing with the pathways cancer cells need to grow. The list keeps going. Even a common antibiotic like doxycycline is being looked at. Some early studies suggest it might disrupt the process tumors use to create new blood vessels to feed themselves. Yeah, the list is pretty extensive. It even includes ivermectin, an antiparasitic drug that's shown some anti-tumor effects in the lab. The thinking is that this collection of well-understood, low-cost drugs could form a whole new arsenal to use alongside standard care. Okay, but, and this is a huge but, this whole approach is at the center of a really fierce debate. Because on the other side, you have critics from the mainstream scientific and medical community, and they have some major concerns about how this is all being promoted to patients right now. An article in Science-Based Medicine by Dr. David Gorski, a surgical oncologist, does not mince words. He basically labels the promotion of these therapies as quackery. The main criticism is that these treatments are being sold directly to vulnerable patients based on what he calls weak evidence and patient testimonials, not hard science. And this gets to a key point of disagreement, the type of evidence being used. See, critics point out that many of these claims rely on observational studies. It's kind of like noticing that people who carry umbrellas are more likely to be wet. It doesn't mean the umbrellas cause the rain, right? It just shows a connection. That's totally different from the gold standard in medicine, the randomized controlled trial, or RCT. That's where you'd actually give one group umbrellas and another group nothing, then send them all out in the rain to see what really works. It's a much more rigorous way to prove a treatment is effective. So let's see how this plays out with a real-world example. We're going to break down an anecdote about a patient with colon cancer, one that was highlighted by proponents as a big success story for this approach. Okay, first things first, and this is absolutely crucial. This patient received the full, proven, standard of care treatments for his cancer. We're talking simultaneous radiation and oral chemo, and then another round of chemo. These are powerful, effective treatments all on their own. Now, on top of all that standard care, he also took a regimen of repurposed drugs like ivermectin and other alternative therapies. And he had an excellent response. His tumor shrank dramatically. But the critics argue it is impossible and misleading to give the credit for that success to the metabolic therapies. Right, because according to the analysis in Science-Based Medicine, that great outcome was completely consistent with what oncologists would expect from just the conventional therapy he received. And this gets to the central problem critics point to, misattribution. When a patient gets a powerful, proven therapy and an unproven one at the same time, you simply can't tell if the unproven therapy did anything at all. So, what's the takeaway here? Well, it's a complicated story.
You've got these really promising scientific ideas on one side, but on the other, you have a controversial direct-to-consumer market where desperate patients are looking for hope.
And for those patients, these programs can come with a pretty steep price tag. For example, the Cancer Metabolic Optimization Protocol, or CMOP, from one clinic, Meakin Metabolic Care, costs $1,200 just for a 3-month program.
And that initial fee doesn't even include the cost of the actual drugs and supplements. Those are paid for separately, and they can add hundreds of dollars more every single month, all paid directly out of pocket.
Some clinics are also offering these high-end preventative packages. For almost $3,000, you can get a whole-body MRI scan plus lab panels, marketed as a way to find health risks before you even have symptoms.
And this really gets to the heart of the whole issue. On one hand, the basic science studying how cancer cells eat in a lab is a very real, legitimate, and exciting area of research, but that's completely different from these direct-to-consumer clinics, which critics say are making premature claims and selling treatments based on science that just isn't proven yet.
It leaves us with this one critical question. Is metabolic therapy the next frontier in cancer care, a brilliant new tool to help patients? Or is it a case of promising, but very early, science being marketed with a lot of hype and a high price tag before it's truly ready for prime time? The answer is probably somewhere in the middle, and only more rigorous science will tell.